Have you or a loved one suspect that you have a disc herniation or told that you have a disc herniation? Having pain from an injured spinal disc can be frightening, and many people worry that they automatically have to have surgery. Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation, fellowship trained in primary spine care. In addition to my training, experience, and education, disc herniations are common conditions that we've been managing for decades in our patients. Now, please know, these videos are not a substitute for professional medical or chiropractic advice for diagnosis or treatment. These videos are for informational and educational purposes only. This video is going to be just a very brief overview and a very, very brief summary. At Twin Cities Headache, Neck, and Back here in St. Paul, Minnesota, we're here to offer you relief from pain, improve function, and improve your recovery to return to work and to your activities of daily living. So what is a disc? Well, discs are soft absorbers that connect spinal bones together. They provide cushion, they provide motion, and discs are made up of a tough ring of tissue on the outside, and then there's a soft interior called the nucleus. The outside is called the annulus, the interior is called the nucleus. And the disc really functions as a shock absorber and connective tissue, holding vertebral bones together and allowing for motion. So the question becomes, why are disc herniations painful? Well, there's a few reasons. Spinal discs themselves are alive. They actually have nerve endings that go into them, some of which are capable of producing pain. So pain from the disc itself is called discogenic pain. Discs can become painful through traumatic injuries, where they're just injured rapidly, or they can become painful through degeneration over time. So the pain from the herniated disc can be due to multiple factors. Now that we know that there's nerve endings in there, what are these factors that can affect those nerve endings? Well, there can be inflammation. The nerve endings inside the disc can express pain from the inflammation or from compression. Leaking disc material, say the discs tear. The material can leak out, and that is chemically painful, and that chemical pain can create another source of what's called pain generation. So how do discs get injured, and how do they herniate? Well, disc injury occurs when a traumatic force rips through the discs and where the force is greater than what the disc can withstand. Depending on how bad the tear is, the inner nucleus, the soft stuff, can migrate and leak out through that tear. Disc herniation is really just a deformed disc. The shape changes, and it's a description from what the radiologist sees on the imaging. And there's three subtypes of disc herniations. There's a disc protrusion, there's a disc extrusion, and then there's fragments called a sequestered disc. Now, the next question that we oftentimes hear from some of our patients that come in, is a disc bulge the same as a disc herniation? The answer is no. Typically, not always, but typically disc herniations are due to traumatic forces creating sudden tears in the disc, usually in the outer annulus, so that the interior can migrate out through there. However, there's exceptions. Bulging, however, is just due to gradual wear and tear and the disc starting to collapse over time. However, there are exceptions to this. Injured discs can also bulge. That's if the support ligaments that contain the disc, that surround the disc, if they get injured, there can be some issues with that, and the discs can bulge even with trauma. But it all depends on the patient, and you need to be evaluated. Now, with degeneration, oftentimes patients come in with that and they wonder how it can hurt. The outer fibers can start to separate, start to fray, the disc can lose its hydration, and then the fibers start to sag outward as you put compression on that. Another question we commonly hear is, can a disc pinch a nerve? The answer to that is yes. If the disc tears, herniates, and extends away from the bone, it can actually compress a nerve that is nearby. That in turn can create radiating pain down the arm or the leg. So the pain down the nerve can be due to inflammation, or it can be due to compression. Both of those are treated slightly differently. So what is our approach here? How do we handle that? Well, first of all, to diagnose a disc as painful, it requires doing an exam, taking an adequate patient history, and to truly confirm it, you do need an MRI, or sometimes a CT scan, to identify the location and severity of the disc pathology of the disc herniation. Based on the location and severity of the disc herniation, treatment planning may need to be modified and recovery expectations need to be changed. If it's really bad, it's going to take longer. Following a proper diagnosis, then we put together an evidence-based treatment plan to maximize recovery. So common procedures with that: gentle chiropractic adjusting. there are certain types of chiropractic adjusting that you should not do, and there's others that have better research support. Hands-on manual therapy, that's also another thing that we oftentimes will do. Sometimes acupuncture, dry needling, traction, rehabilitation, stretching, home exercises, things like that are oftentimes things that patients need to do. Our care here at the clinic is gentle and effective. Research shows that chiropractic care really does help patients with disc herniations. I'm just going to quote a couple of studies here for you just to show you what you can expect from some of the results. So low back, which is called lumbar, disc herniations have been managed for decades through the chiropractic profession. There was a 2014 study where the authors wanted to examine patients with low back pain and leg pain that had confirmed disc herniations on MRI and who were treated with chiropractors. They found significant improvement in the short term, that's like within the first few weeks, medium term, and long term being about a year. The results were very favorable: decreased pain and improved function, meaning like able to do things around the house, return to work. But what about the neck? Well, there was another study that was done in 2016 where they looked at patients that had disc herniations in the neck with radiating pain at times, but it was confirmed with an MRI. They found that the patients with the symptomatic disc herniations that had chiropractic treatment or had injections, they both were better at 3 months. So both worked. And there was no significant outcome at the 3 months between the two. However, long term, at the 3-month mark, more than 75% of the patients who treated with chiropractic adjusting reported clinically relevant improvement compared to only around 38 to 40% of the patients who had received a single injection. And the good news was there was no side effects or bad results from either of the two groups. So from a risk-benefit standpoint, chiropractic treatment is a reasonable first-line approach for spinal disc herniations, whether they're in the neck or whether they're in the lower back. Another common question that we get is, do we work with the medical community? The answer is absolutely yes. Most patients with disc herniations benefit when chiropractic treatment is combined with medical doctors. We find ourselves referring a lot of our patients out for help with neurology, sports medicine, pain medicine, injections. In rare cases, unfortunately, however, some patients, in spite of doing adequate what's called non-surgical care, they still don't improve, and they do need to see surgeons such as an orthopedic surgeon or a neurosurgeon. Our goal is your goal. It's improved function, reduced pain levels, and returning back to the life that you once knew before the disc herniation occurred. So if you have any questions about this, we're here to help you. You can give us a phone call at 651-925-5530 to schedule an examination to find out if you're a good fit for chiropractic management for your disc herniation for you or the loved one that you are researching. Thank you very much.